Hello, welcome to Understanding COVID-19, Prevention and Safe Work Practices on Construction Work Sites. I want to thank you for taking the time to listen to some information that you can use to help keep yourself healthy and safe during this unprecedented time on the construction sites where you work. The guidance presented in this video is compiled from agencies that have control over your work sites, including the Center for Disease Control and Prevention, the Occupational Safety and Health Administration, the Department of Health, and the New York State Department of Transportation. The Governor of New York has issued an executive order that permits construction in support of essential businesses, but only with appropriate social distancing and cleaning and disinfecting precautions taking place. If you're watching this training, the project that you are working on is considered essential. The goal of this training is to give you the information and tools that you need so you can work safely on the job site. The construction covered in this training may include the following, but is not limited to: all facets of bridge demolition, repair, and construction; roadwork, which encompasses all milling and paving operations, as well as excavation and drainage systems to support such work. Other support operations include surveying, and the setting up and taking down of traffic control devices would fall under the umbrella as well. Construction and maintenance of cashless tolling equipment would also fall under the critical infrastructure designation. This would encompass installation and setup of communication buildings, gantries, treadles, removal and replacement of cast concrete, and so on. COVID-19, or coronavirus disease 2019, is a new variation of coronavirus which emerged last year in Wuhan, China. It causes severe respiratory illness similar to but distinct from seasonal flu. The health effects that result from infection with this new coronavirus can range from mild to severe. A small percentage of individuals have infections that can lead to serious illnesses, such as pneumonia, acute respiratory distress, and potentially death. The good news is that most people infected with the virus experience far less severe symptoms, or in some cases, no symptoms at all. People are thought to be most infectious when they are symptomatic. Pay attention for potential COVID-19 symptoms, including fever, cough, and shortness of breath. There are many viruses that can produce similar symptoms, so anyone experiencing them should contact their doctor for advice. There are certain groups that might be at a higher risk if they develop COVID-19, including the elderly and those with pre-existing medical conditions, including heart disease, lung disease, and diabetes. More information can be found at the CDC website shown here. If you develop emergency warning signs for COVID-19, get immediate medical attention. In adults, emergency warning signs would include difficulty breathing or shortness of breath, persistent pain or pressure in the chest, new confusion or inability to arouse, or bluish lips or face. Please note that this list is not all-inclusive. Please consult your medical provider for any other symptoms that are severe or concerning. The most likely route of exposure for COVID-19 is through contact with others who have the virus. The virus must enter the body through the nose, mouth, or eyes for transmission to occur. When an infected individual coughs, exhales, or sneezes, droplets with the SARS-CoV-2 virus can be expelled and land on people or surfaces nearby. Others can then be exposed to COVID-19 by touching these objects or surfaces and then touching their eyes, nose, or mouth. People can also be exposed to COVID-19 if they breathe in droplets from a person who has the virus, who coughs out or exhales droplets. That is why it is important to stay away from people who are sick. The CDC indicates transmission can occur from close contact with an infected source. Close contact, usually deemed within about 6 feet, for a prolonged period of time with a person that has COVID-19. Direct contact with droplets from an infected person's cough or sneeze. If droplets land in the mouths or noses of nearby individuals, or are possibly inhaled into the lungs. Droplets from an infected individual's cough or sneeze that land on surfaces may remain infectious for hours to days, depending on surface type and environmental factors. Studies to date suggest that the virus that causes COVID-19 is mainly transmitted through contact with respiratory droplets rather than through the air. Now that we're aware of the signs and symptoms and routes of exposure for COVID-19, we'll spend the rest of the time reviewing some prevention strategies. First, I want to make sure you understand when you should stay home. We will then cover strategies for social distancing on the job to keep ourselves away from each other as much as safely possible. We will then review personal hygiene recommendations as well as cleaning and disinfecting strategies to help keep you and your coworkers safe on the job. Please help us keep you, your colleagues, and the community safe by staying home when you are sick. If you've tested positive or have been diagnosed with COVID-19, stay home. If you are living with or taking care of someone who has the symptoms of COVID-19 or tested positive, self-monitor and stay home. If you have the symptoms of COVID-19, call your doctor and stay home. Contact your supervisor before you return to work for instructions on a safe return. Social distancing is a key element recommended by the CDC that can be used to help keep the job site safe. To the extent possible while safely performing your job functions, maintain a distance of 6 feet from other workers. Limit close contact as much as possible. We are asking that you do your best to work with your team members and supervisors to develop methods to complete jobs safely while taking into account the need for social distancing at this time. We fully understand that this may not be possible at all times, but we are asking for your partnership to keep everyone as healthy and safe as possible during this unprecedented time. To further the social distancing strategy, the following guidelines will be implemented on all job sites. Daily safety meetings will be limited to 10 people. Multiple meetings will be conducted as needed to include everyone on the job. The employee running the meeting will document who is in attendance. There will be no passing of sign-in sheets or sharing of pens and clipboards. Meetings that involve safety-sensitive activities may include 10 people, but social distancing will be enacted. Meetings, meals, and breaks will be staggered when possible to keep employees separated. Vehicles should be kept to one employee at a time whenever possible. Exceptions include setting traffic control devices and for mobilizing employees when there is limited vehicle parking. Frequent hand washing is a cornerstone of public health. We have evidence from many studies that consistent hand washing can prevent the risk of many communicable diseases, including COVID-19. Frequent hand washing is the absolute key to keeping both yourself healthy and to preventing the spread of COVID-19 on the job. Always wash your hands before eating lunch, before smoking or use of e-cigarettes, after using the bathroom, after blowing your nose, coughing, or sneezing, and after using shared equipment, tools, or touching common surfaces. Additional portable hand washing stations, as seen here and in the previous slide, have been deployed to all job sites to allow for regular hand washing. Posters outlining good hand washing technique have been posted at each job site as well. Perhaps most importantly, never touch your face with gloved or unwashed hands. This might seem like a simple thing to do, but you'd be surprised how often all of us touch our faces over the course of the day. Being conscious of this and avoiding touching your face is extremely important. Touching your face with potentially contaminated hands gives the virus a route of entry through the eyes, nose, or mouth. A bleach solution is being mixed and distributed to all job sites for use in cleaning high-touch surfaces. We know you're busy on the job, but cleaning and disinfecting is an important element to keeping everyone safe at this time. Disinfecting wipes or a bleach solution in spray bottles can be used for disinfecting high-touch surfaces. Hand tools should be cleaned at the beginning and end of each shift. Electronic and communication devices, such as radios, cell phones, and tablets, should be sanitized at the beginning and end of each shift at a minimum and as necessary. Avoid sharing devices. If the device must be shared, then it should be cleaned when transferred between users. Cleaning the high-touch surfaces inside of vehicles of all kinds is also important. This includes excavators, loaders, bulldozers, cranes, forklifts, man lifts, and company and personal vehicles. Employees will clean and disinfect all surfaces using the materials provided. Make sure at the beginning and end of each day, and before each new operator, that the high-touch surfaces, such as steering wheels, shifters, door handles, belt buckles, armrests, and other control surfaces, are wiped with the sanitizing wipes provided inside the vehicle or the bleach and water solution that is provided on site. It's highly recommended for employees to clean their personal vehicles in a similar manner. Portable toilets are serviced routinely, but each individual must take part in keeping the bathrooms clean. After each use, the portable restrooms must be decontaminated with the supplied disinfectant spray. Employees must disinfect toilet seats and other hand contact surfaces at the end of use with the cleaning solution provided. Each portable toilet has been stocked with hand sanitizer. Personal protective equipment. PPE should never be shared among employees. This includes hard hats, high visibility vests, gloves, respirators, hearing protection, and safety glasses. Any reusable PPE should be cleaned often, at least at the beginning and end of the work shift and as necessary throughout the day. Gloves should be worn when touching items that cannot be reasonably cleaned each day, such as traffic cones or barrels and signage. When working on aerial lifts or in close contact with other employees, gloves should be worn as well. Any other tasks where tools and/or parts have to be shared or passed between workers would require wearing of gloves. Respiratory protection. The CDC currently recommends that the only people that should wear respiratory protection against COVID-19 are people that are sick or those that are directly involved in caring for infected persons. All potential illnesses are being reported and tracked to determine any potential contact that infected employees may have had with their coworkers. Anyone who is in prolonged, close contact with a potentially infected person or someone who has been diagnosed or tested positive for COVID-19 will be notified and given further instructions. To the extent possible, medical confidentiality will be maintained. Healthcare privacy laws do not allow for names of potentially infected persons to be publicly shared. In summation, if you have symptoms of COVID-19, you should stay home. Contact your healthcare provider for advice and follow their instructions. You should also immediately report your illness to your supervisor and follow their direction as well. They will let you know when you will be able to return to work. Practice social distancing and good personal hygiene as directed in this video, and follow safe work practices that we have identified here, as well as any specific to your particular job site. We need everyone's help to follow these guidelines and work together to keep our job sites safe in this difficult time. If you have any questions, concerns, or suggestions for improvement, please contact your supervisor or safety officer for more information.